Well, as you probably already know, February is Heart Health Month. RN and co-owner of the Morrison Vein Institute, Terry Morrison, is here to talk about the vital role that your veins play in having a healthy heart. And I never thought about that until just now, Terry. That is, you know what, you're absolutely right. So why is it so important that we take care of our veins to keep our heart healthy?
Well, because it's a big circular path, basically.
Makes sense.
Our veins take the blood towards the heart. They used to make a joke. And our arteries take it away from the heart. So it's a big circular pattern. And veins can be a roadblock. So if we have leaky valves in those veins, then the blood falls backwards and pools in your legs all day long, and that's not a good thing.
No, absolutely not, which, you know, basically equals, I'm assuming, a lot of pain on top of that. You know, a lot of people think that, you know, your veins, you know, just because you're getting older, it's just going to happen. Is that true?
Well, no. Well, yes and no.
Yes and no.
Because
I get that, actually.
50% of women and 25% of men, by the time they're 50, actually have vein disease. So it's not just spider veins or varicose veins. They have a disease.
Wow.
And it gets worse 10% a decade. So if you don't think of it like that, you're just going to say, oh, my feet always swell when I stand up on concrete. Oh, I have restless leg at night because, and oh, I better take some medicine because I have cramping in my feet. And they go to 5 different doctors and take water pills and don't realize that it's just veins, and it would be so simple to fix.
Well, and I'm thinking that prevention is a possibility here if you know what to look for and know how to take care of yourself.
Yes.
What are some of the telltale symptoms, though, that we really do need to have our veins looked at?
One of the classic one, just like right off the top of the bat, is just look down and look at your ankles. If we see little tiny spider veins all around the medial ankle like this, go to a shoe store, go to the grocery store. Nope, you don't. To us, that's a neon flag that says they have vein disease, because when the blood pools down, the body thinks that that's a foreign object, and it sends mast cells and epithelial cells and platelets and all these things that could lead to blood clots.
Wow.
So look at your ankles.
Yeah.
Are they swollen? Do they get swollen just on airplanes, or are they swollen, you know, every day?
Okay, all right. And I know everybody's sitting at home when you said that. Everybody's now looking at their ankles for sure.
Yes.
Let's talk about some of the new procedures, though, that you offer for those who do have vein disease. How can you help people?
Well, the first thing that's very easy is to get an ultrasound scan, and it's specific for veins. They call it a venous Doppler, color duplex, whatever. They have lots of names for it, but you know, I know. So people go, what is that one? I said, well, they're going to call it a lot of things, but it's just for your veins.
Okay, and it's an ultrasound, so you can the physician can really hone in on if that's the problem.
Yes, there's sonographers that are trained to look specifically at all the veins, because you have a deep vein, a superficial vein, lots of tributaries.
Wow.
You have lots of good stuff in there.
Okay.
And your big femoral vein takes 80% of the blood back to your heart, but all those little ones are the ones that get diseased and can cause the problem. So you have to have a vein map to say what to do with them. Okay,
so basically what you're saying is this is not something to mess around with. Like you said, it's the super highway to the heart, so you really have to take care of it. I want to talk about the compression hose, because this is kind of an after care product that you probably offer some of your patients, but look how cute they are. You're actually wearing a pair of compression hose.
Yes, so they can be comfortable and fun.
Why are they so helpful, and why are they important?
Well, ask the insurance companies, because they make sometimes their patients wear them for 3 months before they can even have a therapy, because they want to prevent blood clots while you're waiting. So what they do is they take all the pooled blood and it makes it go up to your heart, and it's very simple.
Which is exactly what you want, right?
Yes.
Keep that blood flowing to where it's supposed to go. Thank you so much, Terry. Good information as always. Let me tell you about a special offer. It's a free vein screening, and this is for the first 20 callers who call into the Morrison Vein Institute. They're located at 6301 South McClintock Drive. That's Suite 115 in Tempe. Here's that phone number to call, 480-775-8460. Learn more, morrisonvein.com.